Flu. Flu symptoms. Flu diagnose. Flu treatment. What is flu, influenza? Hello friends, today we are going to discuss very important topic influenza, which is also called flu. Flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness, and at times lead to death. The best way to prevent flu is by getting a flu vaccine each year. Flu is a common infectious viral illness spread by coughs and sneezes. It can be very unpleasant, but you'll usually begin to feel better within about a week. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one health care. Please also like, share and leave a comment below. Flu symptoms. Flu can cause mild to severe illness, and at times can lead to death. Flu is different from a cold. Flu usually comes on suddenly. People who have flu often feel some or all of these symptoms. Fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, fatigue, sometimes diarrhea and vomiting. It's important to note that not everyone with flu will have a fever. How flu spreads. Most experts believe that flu viruses spread mainly by tiny droplets made when people with a flu cough, sneeze or talk. These droplets can land in the mouths or noses of people who are nearby. Less often, a person might get flu by touching a surface or object that has flu virus on it and then touching their own mouth, nose or possibly their eyes. Period of contagiousness. You may be able to pass on flu to someone else before you know you are sick, as well as while you are sick. People with flu are most contagious in the first 3 or 4 days after their illness begins. Some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Some people, especially young children and people with weakened immune systems, might be able to infect others with flu viruses for an even longer time. Complications of flu. Complications of flu can include bacterial pneumonia, ear infections, sinus infections and worsening of chronic medical conditions, such as congestive heart failure, asthma, or diabetes. People at high risk from flu. Anyone can get flu, even healthy people, and serious problems related to flu can happen at any age, but some people are at high risk of developing serious flu-related complications if they get sick. This includes people 65 years and older, people of any age with certain chronic medical conditions, such as asthma, diabetes, or heart disease, pregnant women, and children younger than 5 years. Preventing seasonal flu. The first and most important step in preventing flu is to get a flu vaccine each year. The flu vaccine has been shown to reduce flu-related illnesses and the risk of serious flu complications that can result in hospitalization or even death. CDC also recommends everyday preventive actions, like staying away from people who are sick, covering coughs and sneezes and frequent hand washing, to help slow the spread of germs that cause respiratory, nose, throat, and lungs, illnesses, like flu. Flu diagnose. It is very difficult to distinguish flu from other viral or bacterial respiratory illnesses based on symptoms alone. There are tests available to diagnose flu. Flu treatment. If you get sick with flu, antiviral drugs may be a treatment option. Check with your doctor promptly if you are at high risk of serious flu complications and you get flu symptoms. People at high risk of flu complications include young children, adults 65 years of age and older, pregnant women, and people with certain medical conditions such as asthma, diabetes and heart disease. When used for treatment, antiviral drugs can lessen symptoms and shorten the time you are sick by 1 or 2 days. They also can prevent serious flu complications, like pneumonia. For people at high risk of serious flu complications, treatment with antiviral drugs can mean the difference between milder or more serious illness, possibly resulting in a hospital stay. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one health care. Please also like, share and leave a comment below.